Today we talk about, can an abortion cause you to be infertile? I'm Dr. Mark Amols, and this is Taco Bout Fertility Tuesday. I know this podcast may not be for everyone, but I think it's important for women to know that if they have an abortion, or if they did have an abortion, would it affect their fertility in the future, or is that what's causing their infertility now? And this is so important to me that anytime I see someone with an elective abortion in the past, I make sure that they know that it isn't the cause of their infertility, or at least shouldn't be the cause of their infertility. The simple answer is going to be that yes, anytime you do any type of instrumentation of the uterus, you can have infertility. But on the same token, the chances of having infertility from an elective abortion are very, very small to almost zero. And so I want to talk about a little bit more to give you a better idea of why I'm saying this. I'm not just saying it to appease anyone or make anyone feel good. Regardless of what you think of abortions, the important question is that did it affect your fertility, and will it affect your fertility in the future? Now, the type of abortions we're talking about are surgical abortions. Those are the ones that really have any chance of really causing problems with infertility, because it can cause problems inside your uterus. Now, when we talk about things like pills that you take that cause an abortion, or if you even have Plan B, which prevents you from getting pregnant, none of those can cause any infertility for sure. We're only talking about one type, and that is going to be a surgical abortion. A surgical abortion can be done many ways. It can be done in the clinic. It can be done in the hospital. It can be done between early stages, and it can be done in even later stages. The further it's done later in the pregnancy, the higher the risk of potentially having a complication. The earlier, there's less complications. Now, the procedure is usually called a D&C, which stands for dilation and curettage. I don't want to be graphic, but I want to also be honest that what happens is it's either a suction device that is placed inside the uterus, and then the suction removes the tissue inside the uterus, and so it's kind of scraping the walls. Now, when we do this, we try to do this with very less aggression, so that way we're not causing any potential scarring. We'll get into in a minute why there's the risk of scarring. Now, this can also be done without suction, so there can actually just be an instrument that goes and scrapes the walls, and that would then cause abortion by you removing the pregnancy. And there's even handheld ones that could be done in the clinic, and those were placed inside of the cavity, and the suction is applied and they scraped inside the uterus. And even if they don't get everything, that's fine, because it's enough that will cause the miscarriage, and usually the body will pass everything afterwards. The important part to understand is that you're not getting scarring in the uterus because of the procedure, but actually when you're pregnant, your uterus reacts different. And that's the risk factor, that when you have the D&C in the pregnancy, that causes the risk of scarring. If you just did a D&C for, let's say, heavy bleeding or polyps, you actually would have almost zero chance of getting scarring in the uterus. But when you do it in a situation where you're pregnant, that's where you end up having issues of getting scarring. Matter of fact, the common situation is that someone, for example, had bleeding after delivery and they had to do a very aggressive D&C because they were hemorrhaging. And that's usually when you get scarring, because they're being so aggressive and it was pregnant. But usually in a elective abortion in a controlled environment, the chance of getting scarring is very little, almost zero. So please, if you've ever had an abortion, do not blame yourself. I don't care what anyone else says. I don't care whatever you read. It's not true. You did not cause your infertility. And regardless what the outcome is, even if you had scarring, the chances are so low, you cannot blame yourself. The good news also is that if you are that small percentage of people, less than 1%, who get scarring, sometimes that can be actually treated with surgery and can be fixed. And only a small percentage of the people who have the scarring can not be repaired. But for most people, you can do a procedure called a hysteroscopy, where we go inside the uterus and we then cut out the scarring. And usually that's very minimal. Now, are there cases that are very severe and that people can never have repaired? It is, but they're extremely rare. I personally have never met a patient yet who has had an elective abortion that has ever not been able to have it either repaired or be able to get pregnant because of it. Hopefully for the people who have had abortions, this will give them some feelings of comfort that they didn't cause anything. And if you know anyone who has had, please let them know. No one wants to get an abortion. And if they do, it's even worse if they feel like they caused their infertility. And they didn't, because this doesn't cause infertility. In the next few weeks, we're going to go over Asherman syndrome. And that is when the uterus is completely scarred and how that's treated, what things you can do to help it, and sometimes when do you have to throw in the towel and use a surrogate. As always, I greatly appreciate everyone who listens. If you like us, please give us a 5-star review, tell people about us. And as always, I really appreciate you listening. Until next week, this is Taco Bout Fertility Tuesday.